of a dental documentary coming up in Madeira. From Ideal Smile, please welcome my guest today. This is Dr. Akib Mudassar and Gina, who works in the office there. Yes. Thank you for coming in today.
Thank you.
Appreciate it.
Thank you for having us.
All right, so June 18th is the big date for the documentary, right?
Yes.
What are people going to see?
It's about a movie which really brings out the connection between the oral cavity and the body, and emphasizes on the need of prevention, where so many things are happening because of the infection in the mouth, and it's causing heart attacks and strokes and diabetes and a lot of other diseases. And it's really about the awareness, where we want people to know that taking care of their oral cavity and any infection in the body can prevent from getting those diseases, chronic diseases our loved ones suffer with.
Yeah, most people probably don't realize that, if you floss and take good care of your teeth, your whole body benefits, correct?
Yep. Yes.
It's the bacteria which circulates. I mean, you eat and we do everything to eat, and it spreads in the blood, goes to the heart. People are getting strokes and heart attacks because of that.
Okay, so the movie is called Say Ah.
Yes.
And we have a little preview for everybody, so let's take a look at that right now.
Right now, we're in a defining time in healthcare.
We're in a state of chronic inflammation.
75% of our medical costs are caused by chronic disease, by things that we can prevent.
There doesn't have to be any one hero. There just has to be a whole lot of heroes working together.
Say Ah, June the 18th. It's going to be shown at the Madeira VFW Hall. Why did you think it was important for the people in Madeira to see this documentary?
We actually, it's just creating the awareness. A lot of people know about it, but it's just, there is a challenge in the dental field and in medical field. Our training was really to focus on the chief complaint. So we all know that there is a connection, but no one is really taking time. We have a patient who was referred by a physician because he walked into his office with pain in the gums, and he called. He said, I am sending a patient over because he's having a lot of pain in his gums. And that guy was 29 years old, and he's diabetic and hypertensive. And the thing is, he was going to him for 1 year, and there's a lot of infection. And the doctor told me himself that, when he walks into the room, he smells really bad. So he had that awareness that, he has something going on in his mouth, but till the patient actually brought up that he's having pain, doctor really didn't pay attention to it. If the diabetes was, he had diabetes, and if the infection in the mouth was controlled, his diabetes was going to get better with it. Now we have research done by United Concordia that if somebody who is suffering with diabetes and they take care of the oral infection, the cost for each, on average, drops down like $3,200 for each patient.
Really?
So that's just there is a connection. We're just missing the pieces. We're trying to put things together,
and you think this documentary puts those pieces together for
right.
people?
And we're trying to really get involved with our medical community, and we're really trying to invite medical physicians and cardiologists are going to be there. So, I mean, we can all really work together to make our community the healthiest in America.
Okay. You have offices in Madeira and Fresno. Are you planning to show this at all, maybe in the Fresno area sometime down the road?
We are planning to have a screening in sometime in October, late October or November. We haven't decided the date. We just focus on this first, but we're definitely doing one in Fresno too.
Yeah. Do you expect a good turnout for this?
I think we'll have good turnout. We're getting really good response from people.
There's no charge for it, right?
There's no charge. There's at least 5 medical offices. They're asking all the patients to really come and come for the event and just really get to know what it is about. And everyone we have talked to, they had really good response.
How would you rate Madera as far as do a lot of people take care of their teeth, or?
It's about the same everywhere.
Really? Okay.
It's about the same.
Different
everywhere.
communities don't have different levels of the way they take care of their teeth?
It's awareness, it's a negligence, and then people have different priorities, and I think bringing all this together, I think that will make a difference.
You were smiling over there.
Well, I think it's not necessarily different communities don't. It's not like, well, this community is better than the other. This one takes care of themselves better than the other. Like Doctor said, it's all about education. So awareness. So what we're really trying to do is just educate everyone, and really talk to them about complete health instead of just the mouth. Because if you take care of your mouth, you'll be taking care of your body altogether. Because if you have, for example, he hasn't mentioned it yet. There's a saying that we like to go by. So for instance, if you had your hand and you got a cut in it and you're bleeding, wouldn't you take care of that right away?
Absolutely.
And then, okay, so if you look at it in a different term, so say you had infection in the mouth and you had bleeding gums and you bleed when you brush or floss. Isn't that the same thing? Isn't it infection? But we ignore it. So that's something we're trying to really educate our patients with, and our community in general, that you need to that you should take care of your mouth, because that's going to be connected to your whole body.
Good advice.
So,
good advice.
Yes.
Now, sometimes when I floss, I may see a little bit of blood. Does that mean an infection? Maybe. Really?
In that particular area.
That particular area.
Right. It can be generalized. It can be just localized in one area. But I mean, you don't want to have blood when you floss or brush. It's not healthy.
Mm-hmm.
But flossing is so important, right?
Yes.
It is.
Yeah. My dental hygienist pounded that into me for years, and I do it now. I do it regularly.
That's good.
And it makes a difference.
Yes.
My cleanings now are so much easier. And she tells me what a good job I do. Go ahead.
From what she was trying to say is, when we have a cut on the gum is size of like a palm of a hand, and we are not okay with having an infection or any disease on a hand, but yet we are okay with having the same thing in the mouth. And it's just like when we have a cut, we get an inflammatory response which tries to heal the area. But when we have an infection which keeps going on, that inflammatory response never stops. And at some point, body gives up, and that really triggers all the chronic diseases.
Gotcha. All right. So the date again is June 18th at the Madera VFW Hall, a free showing of the documentary Say Ah. It's all about dental health. If people want more information about either the documentary or about your dental office, where can they go?
They can call us at 662-1010, so that's our contact number. We are promoting it also on our Facebook page, which is Ideal Smile Dentistry. And also, I wanted to say that we have been getting, because you asked earlier, the turnout that we're going to be getting. Well, we don't have an actual number of how many people, but we're expecting a really good turnout because I have been going and speaking with the doctors around.
That little fly up there.
I've been speaking to the doctors around our community, and
they know how important this is,
and
right?
I've been speaking to their teams as well, and the people from there, and they're really like, once we show them the little 2-minute clip and we talk about, really partnering up together and educating our community, they're really supportive.
The flies on Doctor's
Thank you both
shirt.
for coming in today. I appreciate it. I hope you do get a good turnout.
Thank you.
Say Ah here on CentralValleyTalk.com.
Thank you.
Hi, I'm Pete Fagun.